talk to me real quick. So tell me who you are.
I'm Dr. Brad Poppy, physical therapist from Denver, Colorado.
And what is your passion when it comes to rehab and health for people?
Basically, helping people manage their dysfunctions. You know, getting patients back to their maximum rehab potential, whatever that may be. Pain-free, being able to walk downstairs, being able to hold their grandkids, whatever that may be.
So now you have in your hand a thing called the spingym. I'm going to play a little bit so I can see you play with it if and when you choose to play with it. Tell me about what you're holding in your hand.
So spingym, small little piece of exercise equipment that's not only fun, it's versatile. You can use this in the privacy of your own home, obviously. And it looks like it's doesn't really do much, but there's a whole exercise regimen that we use with our patients with the spingym. Everything from cervical, thoracic, lumbar problems, shoulders, knees, hips, everything. It's like a full body workout safely that we use with our patients.
So I'm incredibly skeptical, Doc. I got to tell you, I'm looking at a toy in your hands. I don't get it. How is that a rehab product?
Because what it engages muscles, number one, that you don't typically use, and it engages them in a fashion that you don't typically use them in. Okay, so it's one thing to move muscles through a range of motion, certain range of motion, and get benefit, and you can do that. But it's a whole different ballgame to not move them isometrically and have a contraction where the muscle doesn't really move, but it's still contracting. And we use those a lot in the acute and subacute rehab phases to introduce exercise and blood flow to tissue for these patients.
Could you show me some of your favorite exercises?
Yeah, absolutely. So number one, and in our society, so many people are, the computer workers, the desk, the hairstylists, and we have that kind of rolled in shoulders and forward head posture. That just in general sets you up for a lot of osteoarthritic changes throughout life and poor circulation and just a lot of bad things, basically. A lot of pain, chronic pain, actually. So one of the exercises that I use a lot is basically just this right here. And what I'm doing is I'm just getting myself in an anatomically correct position, okay, good posture, if you will, right? And just almost squeezing my shoulder blades together, kind of like I'm squeezing a pencil between them. It's nothing crazy, but it's extremely difficult because I'm utilizing not only those little tissues, but my whole spine. So I'm exercising my shoulders, my upper back, but really my whole spine. I'm feeling it in my low back, actually. So
talk to me about how important it is to be compliant. With you go to a program, you've been hurt, you got this. Why is this the best thing you've ever seen?
Because number one, compliance is everything with anything in life, right? Exercise-wise, personal trainers will tell you, well, if you're not going to continue, then it's gonna, you're gonna lose all your gains. And the same thing with injured patients. They have some sort of a dysfunction or a problem in their spine or whatever you're treating, and you have to make sure those tissues heal properly to help prevent chronic disease or pathology, right? So the stronger we can keep that injured joint or area, the better shot we have of achieving that.
I'm a very pessimistic person. My last question to you, I look at that, I don't really get it. Really, you put your credibility on this. Will you explain to me why I should use this in my practice?
Number one, when you put this in the hands of a patient, they smile, okay? Because it's innovative, it's different, it's fun, okay? When you put a smile on someone's face that doesn't want to be in your office, mission accomplished, you won. Okay? And so when they start to use it, they will start to see how difficult it really is. It's hard. You get an amazing workout with it. And when they enjoy what they're doing, their compliance goes to the roof. And you'll get really good gains with that.
Awesome. Justin, have a seat for a second. Let me just trade you out. Because I have,
sure.
You might want to turn that camera on.